Hi everyone, my name is Julia McLean and I'm currently a student in the Radiologic Technologist program at Nebraska Methodist College. Today I'm excited to talk to you about radiation protection, why it matters, how to do it properly, and how we can keep both ourselves and our patients safe. So my audience is a group of radiologic technologists in southern Georgia, and the setting is going to be at a monthly staff educational meeting in a clinical conference room. So this is radiation protection, a responsibility, not just a requirement. So I have my objectives listed. We are going to identify the current NCARP and ARRT recommended dose limits for occupational exposure, demonstrate proper placement of lead shielding and dosimetry badges, and explain the importance of radiation protection in daily practices. By the end of this session, you'll be able to confidently meet these 3 objectives. I'll also walk you through a few hands-on and visual examples along the way. We also have our focused message. This is going to be, radiation protection is not just a requirement, it's a responsibility. This message will guide our meeting today. Whether you work in fluoroscopy, general radiography, or portable imaging, radiation safety must be met. So first, I have this guided learning pre-mini quiz. I'm going to have you guys take this and take maybe 2 to 3 minutes to complete this quiz and just set it aside. And then at the end, I'm going to have you guys take this quiz again, and we are going to use it to see how much you have learned. So first off, background on radiation. We need a refresh on the general background of radiation. There are 2 main types of radiation, non-ionizing and ionizing. Some examples of ionizing radiation include gamma rays and X-rays. Non-ionizing include radio waves, ultrasound waves, and microwaves. The one that we commonly see in our occupation is ionizing radiation. Ionizing radiation is a type of energy released by atoms that travel in the form of electromagnetic waves, and this was said by the WHO Foundation. I have also included a picture of the electromagnetic spectrum describing types of radiation, with radio waves being the least harmful and gamma rays being the most harmful to us. Now onto dose limits and regulations. Let's start with the numbers. According to the NCRP, the annual occupational dose limit for whole body exposure is 50 millisieverts. For the general public, it's much lower, about 1 millisievert. Knowing your dose limits help you stay within safe zones and protects from long-term health. If we were live, I would ask you to estimate your last dosimeter badge report and tell me if you would be in the safe limit of occupational exposure for the annual amount. Would you be projected to be in the safe zone, or based off of your current report, would you exceed your annual limit if the trend stayed the same? So before we move on, let's talk about a couple of these numbers. For occupational exposure, the annual amount is 50 millisieverts, and the cumulative amount is 10 millisieverts times your age. So I'm 21, so my cumulative or lifetime dose that I can have is 210 millisieverts. There's also different ones for the public. So the public, you can only have 5 millisieverts. And same for pregnancy. Your monthly for pregnancy is 0.5 millisieverts, and the entire gestation is 5 millisieverts, which is very, very low, which is why radiation protection is needed. All right, dosimeters. The primary source of a radiologic technologist's radiation exposure comes from scattered radiation emanating from patients. In order to keep the RadTech's occupational dose exposure lower than the annual effective dose of 50 millisieverts, the levels must be monitored. We wear an optically stimulated luminescence dosimeter, also known as the OSL. This should be worn outside of the lead at the collar level to calculate our whole body EQD. I have a picture of the OSL dosimeter below. I'm sure we all have one on right now. I want you all to locate your dosimeter and observe where it is located on your body and observe the person sitting next to you. Is it in the correct spot? If not, show them where you should place the dosimeter and explain why to them. The ALARA principle. ALARA stands for as low as reasonably achievable. ALARA is the gold standard that we must all follow. It means we always aim to use the lowest dose possible while still achieving diagnostic image quality. Before exposing your patients, make sure you ask yourself, is this exposure necessary? Can I reduce the amount of repeats? And can I shield better? With ALARA comes the 3 cardinal rules of radiation protection. Radiation exposure follows these 3 simple rules, which include minimizing time, maximizing distance, and use shielding. Time is related to exposure time and exposure rate. To minimize time, we want to use techniques such as a high kVp and a low mass to minimize time and obtain optimal image quality. For distance, radiation exposure is inversely proportional to the square of the distance. Therefore, if we doubled our distance, our exposure would be decreased by a factor of 4. The ICRP and NCRP recommended a safe distance of 2 meters or 6 feet from the source of radiation in image intensifier fluoroscopy setup, and the minimum source to skin distance should not be less than 12 inches for a mobile C-arm. For shielding, attenuation of radiation exposure by protective devices between the source of radiation and exposure is essential. Some devices include lead aprons, thyroid shields, lead gloves, gonad shields, and gloves. Reduction of the exposure time, increasing the distance from source, and proper shielding are important for protection. I want you to go into your radiology department and go find some shielding devices that you would commonly use to protect yourself. And lastly, we are on to the biological effects of radiation. If we did not utilize the ALARA principle and the 3 cardinal rules, we would suffer greatly from the biological effects of radiation. Radiation effects fall into 2 categories: deterministic effects and stochastic effects. Deterministic effects, which are effects that occur after a certain threshold. Deterministic effects are short-term, adverse tissue reactions resulting from a dose that is significantly high enough to damage living tissues. Some examples include radiation-induced skin burns, which can be skin erythema, which is the top picture, acute radiation syndrome, radiation sickness, cataracts, which is the picture of the eye, sterility, and tumor necrosis. We also have stochastic effects, which have no threshold and can happen from even small doses over time. Stochastic effects after exposure to radiation occur many years later. These can include cancer and heritable or genetic changes. This is why we must always use radiation protection to keep our bodies and our patients safe from radiation. Practice safety tips. All in all, you should keep up with radiation protection. Some safety tips from me that I use daily include: keep shielding gear in good condition, review positioning to avoid repeats. This avoids exposing our patients to more radiation, and maintain safe distance during exposures. Never hold a patient ever unless you have to. This can add the amount of dose that you are receiving as well, even if you are wearing a lead. Maintaining these habits becomes second nature the more you practice them. I challenge you to try one of these new strategies the next time you are in the radiology department. Here is the quiz that we took at the beginning. I want you to take it again and see how much you have learned. Once you are done, we are all finished. Thank you for listening today, and remember to always protect yourself from radiation. And these are my references.